Hey everyone, it's Dr. Keys. Welcome to the Keys to Confidence podcast. I'm here with Shauna, my wonderful office manager, and we are excited to chat about all things skin, beauty, health, wellness, and to help unlock your inner confidence. If you have any questions you would like me to answer on future episodes, send us a DM on Instagram at KeysMD Cosmetic Clinic or email us at info@keysmd.ca and I'll try to answer as many as I can on upcoming shows. If you like what you hear, don't forget to share and subscribe so that you never miss another episode and to help us grow. Now let's get started.
Welcome to another episode of Keys to Confidence. I am Shauna and I'm joined here with Dr. Keys. Dr. Keys, what do you put on your Subway sub?
On my Subway sub, I get the cold cut trio, no salami, double ham.
But you have to say that you take the bread out because I don't think people want to know that.
Yeah, and then I also get them to take the bread out, so there's less bun, less carbs, less bun, more just less bun.
And just like the ham and that's it?
What's in that? Ham and pepperoni, maybe, or ham and summer sausage. But I don't like the salami part of it.
And that's it.
That's
like no
it.
toppings.
Lettuce, green peppers, banana peppers, lots of hot sauce, salt and pepper. The end.
The end. Love that. That sounds like the worst sub ever.
Yeah, maybe.
I didn't have the best experience the last time I was there, but I do love a turkey sub. Totally switching topics, but today we are talking about varicose veins. Dr. Keys, what are varicose veins?
Well, before, actually, I kind of want to know what your traumatizing experience was when you got your last sub.
I was extremely I had been drinking the night before, and there's just something about slimy meat that makes me throw up, thinking about it now. Okay, back to veins, Dr. Keys. What are varicose veins?
Sorry, I got a little sidetracked. I guess before we get into varicose veins, we should just briefly mention what a normal vein is like. So I guess you'll better understand what a varicose vein is if we kind of describe what a normal vein is. So normal veins are typically tight and have some elastic recoil, and they have veins inside of them. And then we also have a muscle pump in our calf muscles. So when we walk, it helps push the blood back up, and veins go towards the heart, arteries go away from the heart. So what the valves do is they prevent the backflow of blood back down towards the feet. So when you get a varicose vein, that is when these tight veins with that elastic recoil get overstretched. And so it's kind of like an elastic band that's lost its elastic recoil. And then when you increase the intravenous pressure, like when you're standing or walking, running, these veins will bulge out of the legs. And that's typically what is causing these varicose veins. So when the vein is dilated, the veins don't really meet in the middle like they used to, and it causes the blood to pool down in the lower legs, right? So, then you can't effectively move blood back up towards the heart against gravity. So that's typically, or that in a nutshell is basically what a varicose vein is. So in terms of the veins, when you're thinking, when you're thinking of the valves, you can think of it as like a double door, and you're walking through them, you're pushing both the doors open, and they only go one direction. They don't go backwards. But when the valves get faulty and they're not working properly, they can fold backwards, and that's where the blood will kind of flow through back down towards your feet.
So interesting. I feel like there's so many parts of our bodies that we just we don't really know much about unless that's something that we study or look more into, kind of thing.
Mm-hmm. Yeah. I mean, I guess most of us don't really know how the body works. But yeah, I mean, it's fascinating. This topic is probably somewhat boring to the average person, but it's something we offer here. I think it's kind of interesting. So
yeah,
here we are.
You're a little nerd.
A little nerd. That's right.
What are the symptoms patients present with?
They can come in from any range of concerns. Some will come in just with spider veins, and it's just a cosmetic thing to them. They don't like the appearance of them, and they want those gone. And then other people have dilated and engorged varicose veins, which are, kind of unsightly to most people. Most people don't want them. So, we can treat that, but they can be anywhere from asymptomatic, where they don't cause any issues, and it's just a cosmetic concern, or they can have these heavy and tired, aching legs. As it progresses, they can be itching and burning. You can get edema or swelling. You can also get muscle cramps, restless legs. You start getting skin changes like venous eczema. You can get hemosiderin staining, and that's when the blood kind of leaks out of the vessels and the hemoglobin breaks down, and the hemosiderin will then stain the skin this brown color.
Wow.
And then there's something else called lipodermatosclerosis, which is like a fibrous tightening of the lower legs. And then as it continues to progress, you can get these venous ulcers too. So
wild.
It's very broad, right? It's
very
a broad range from nothing to like debilitating symptoms.
What are some of the risk factors for developing them?
Increasing age is probably one of the biggest ones. Family history is pretty large. So if one parent has them, you have about a 50% chance of getting them. If two parents do, it's been reported up to as high as 98% of you getting them. So that's pretty huge. Being female, that is another one. Pregnancy, yeah, and pregnancy. So just don't ever have kids and you're fine. But pregnancy does it. There's increased pressure, obviously, because you have a big baby growing inside of you. So there's just increased uterine pressure there. There's increased blood volume, the hormones. There's several factors that play into this, but pregnancy is one. Obesity, also increased pressure, prolonged standing. So like hairdressers, nurses, factory workers, etc. Just people that are standing all day increases the risk. Wearing high heels, which I'm sure most women don't want to hear, but it disengages the calf pump that I mentioned earlier, where the calf muscles contract to pump the blood up. That doesn't work properly. And then things like DVTs that are less common increase the pressure and make them worse.
I think some women might not enjoy the comment about the high heels, but at the same time, have you ever worn a pair? Your feet and your legs hurt like so bad at the end of the day.
Yeah. Have I worn a pair every weekend?
Oh my, I wouldn't be surprised.
I have not. And I'm guessing most women aren't going to be like, you know what? I'm not wearing high heels anymore because of increased risk of varicose veins.
I think the importance too of like making sure, like telling people and educating people about the socks that you can wear, the compression stockings. I mean, they're not as cute as like regular socks, but they definitely will help. I know so many people that work on like super hard grounds like during the day, and their legs must just be so sore at the end.
Mm-hmm. Yeah, and they are getting better, right? There's tons of designs now, and you can get them that look like normal socks. So, but yeah, I mean, if you're wearing if you're sockless in your high heels, obviously you're not going to want to wear them when you're going out for the night, right?
Yeah. You don't, that's like, I guess it's not really, unless you're looking for a new fashion statement, it's probably not the best
the best look
choice.
Yeah.
Yeah. How common are varicose veins?
They are actually quite common. It's been reported that about 23% of adults have varicose veins, and over 50% of adults over the age of 50 have them. And then if you bring in the spider veins and reticular veins are they're a little bit bigger than spider veins, but they're not as big as varicose veins. But if you bring those into this calculation, it's about 80% of men and 85% of women will have these types of veins. So yeah, it's very common actually.
And I feel like now that we talk about veins more often, I notice it more. I've definitely noticed a few on my legs. They're tiny, but they're still there.
Yep. Just like working in aesthetics, right? You start noticing things that you maybe wouldn't have before, for sure.
When do patients come in to see you?
I guess whenever it's a concern to you. So for people with spider veins, they're going to come in if it's just a cosmetic reason and they have no symptoms. They'll come in just to get that treated. And then others will come in because they have the bulging varicose veins. Sometimes they're asymptomatic, but they just don't like the appearance, so they want that taken care of. And then there's others that have the symptoms, the heaviness, the aching, the swelling that come in, and they just want that gone. They don't even really care about the cosmetic outcome. They just want to feel better. And often those are the patients that are the most happy because they just feel so much better after. So,
For sure. I'm sure it's like a huge like relief after they have the treatment done.
Yeah, exactly.
How are varicose veins assessed?
There's different techniques that you can do on physical exam, but really the gold standard is just doing an ultrasound and doing a vein mapping. So normal ultrasound facilities don't always do a proper vein mapping. So sometimes you do want to actually go to a vein center where they do a proper vein mapping, where they really map out the veins and see which ones are varicose, which ones aren't functioning properly, so they can be treated appropriately.
To me, like this sounds so interesting, like just the whole ultrasound, the veins and everything, but it is quite more of like a simple procedure.
Yeah,
I guess you could say.
Yeah, if you know what you're doing, or once you know what you're doing, it can be a little bit more simple. A vein mapping done properly can take up to 45 minutes. So it's it's a little more involved than you might think. And for someone that has never looked at an ultrasound before, they would think they're looking at like sand on a screen or something that makes no sense at all.
I know. I think I was talking to someone the other day, and we were talking about ultrasounds, and they were saying how hard it is to read an ultrasound. And I was like, when we were doing some of the training here, I obviously was just watching what you were doing, but yeah, looking at an ultrasound screen is very confusing.
Yeah, it can be for sure until you know what you're looking at.
What are the more simple conservative treatment options for patients?
Yeah, there's quite a few things that can be done before you start getting any procedures done. One of the biggest and most important things is weight loss. Obviously, easier said than done. Staying physically active, keeping your legs elevated when possible, and then I guess maybe the easiest and best is compression stockings, especially for those people that are on their feet all day or have symptoms.
Which is like, I guess it's probably a relief for people to hear that, because sometimes, or I guess some people may think that you need just to have the surgery right away.
Mm-hmm. Yeah, I did my residency and everything in the United States, and for it to be covered, for the procedures to be covered under insurance, they had to prove that they had compression stockings, or they tried compression stockings for 3 months at least to see if there was any relief from that alone.
Wow.
Yeah.
What are some of the more invasive and surgical options for patients?
Once you get into procedures, so spider veins, we use lasers here as well as injections. For the bigger veins, the gold standard for the more surgical or procedural options are EVLA, which is endovenous laser ablation. There's radio frequency ablation, and there's a venous seal. They're done similarly, EVLA and RFA, the laser and radio frequency. There's a little more needles. You have to use tumescent, which is kind of a numbing medication that you put around the vein. And then you use a heat energy or radio frequency energy to close down the vein. And then venous seal is more of a new procedure. It essentially is using crazy glue. You put glue inside of the vein and that closes it down. The advantage to that is that there's no tumescent, there's less needles, and there's less downtime. You typically don't need to wear compression stockings after, where with the other ones, the EVLA and the RFA, you have to wear them for a couple of weeks after that treatment. So less downtime, less needles, less pain. So that one's a good one. The only downside for everyone involved is it's a little bit more costly. And then after that, there's ultrasound guided foam injections or sclerotherapy. That's basically where an irritant is injected into the vein and cause it to close. And then there's the older way of closing it down or getting rid of it, which is the surgical stripping of the veins. And I'm not even sure if anyone in the city is doing that anymore. I was told that there isn't. So a vascular surgeon would typically do that, where they go into the groin area and ligate the vein and basically cut it and strip out the vein. Much more downtime to that. Not as advantageous because there's a much higher recurrence rate with that, so it doesn't work as well. So yeah, that's not done as much anymore. And I know in other cities, it's about a 5-year wait to get that done. So definitely not done as often as it used to be.
So interesting. I guess with technology and everything, treatments that you don't have to do, you don't have to do that. That's probably why people aren't doing it in the city anymore, right?
Yeah, exactly. I mean, the techniques have improved so much, like you were saying. It's why would you go under the knife and have the downtime and the surgery when you could have the procedure done?
And I think the name, like the stripping name, just that's kind of scary within itself.
Yeah. There's sometimes some horror stories, or we've maybe all heard some horror stories. Maybe me more than the average person, since I look after patients. But yeah, there can be downsides to that for sure.
Tell us more about training that had to be done for veins.
Yeah, that's as you know, that's been a bit of a ride for me. So
yes,
I did my train in Michigan in 2015, and I came back to Canada to see what it would take for me to do it here. And I figured I'd just have to prove that I did my training somewhere else. And I had a letter of recommendation and everything for doing the treatments there. And I came back here and I was told that I had to do that training again, which was a lot of procedures, not something that could be done in a day or two, which made it quite difficult. Taking time off work and traveling and finding someone to do the training, etc. But as you know, I'm not going to back down to a challenge. So I went and completed the trainings just so I could be able to offer it here. It didn't really make sense. I had the training and skill and knew how to do it already. So it just made sense to try to push through and get it done so I could offer it here.
It's an amazing and inspiring story to so many, because I mean, you've been put up against so many things just to try and stop you, but you're still going.
Yeah, I guess if you know all the details, then it might be a little bit more inspiring. But yeah, it has not been easy, but I think it's worthwhile for patients in the area because no one is really doing it here, and people are traveling hours to get the procedure done. So,
and the moral of the story is you love veins.
And I love veins.
I guess for people who don't really know where to start or where to go, what would the advice be?
That they have to come see us.
Yes.
There's no other option.
Just come and see us and we'll take care of you.
That's right. No, but for real, I mean, a lot of people don't know what they have, what type of veins they have, what the treatment options are. I mean, if you listen to this, they still might be confused between, for what treatment actually is right for them. So coming in for a consult is going to be most beneficial for them, so we can discuss what's going on, see what type of veins they have, potentially get some ultrasound done to see what's going on under the surface that we can't see, and that would be, I guess, the first line, just to come in and see us.
Was there anything else you would like to tell our listeners about veins?
To excite them even more about how amazing this topic is.
Yeah.
I mean, not really. I guess just really this whole topic, it's very common, which is why we kind of wanted to touch on it. It can be just from a cosmetic standpoint or medical because of the symptoms that they can cause. And first line is they could come in and see us even regarding compression stockings. Even if you have a job where you're standing all day, or you have spider veins, or you have a little bit of swelling, come in and see us and we can get some custom compression stockings measured up for you and ordered for you. And then getting the proper assessment and potential intervention done. So that's pretty much it.
Well, that was a lot of information and a lot of interesting information. And hopefully this podcast will help someone who's going through issues with their veins. Thanks again for listening. We'll see you next time.
If you have any questions you would like me to answer on future episodes, send us a DM on Instagram at KeysMD Cosmetic Clinic or email us at info@keysmd.ca, and I'll try to answer as many as I can on upcoming shows. If you like what you hear, don't forget to share and subscribe so that you never miss another episode and to help us grow.